Good afternoon, everyone, and thank you for joining us for this live conversation. And welcome back to those of you who may have joined us at noon for our moment of reflection in honor of the first anniversary of COVID-19 in Delaware. Today also happens to be the first anniversary of the World Health Organization declaring COVID-19 a pandemic. So much has happened over the last year, and it's important that we talk about it. So today we've brought in Dr. Suzanne Bauer and Dr. Stacey Boyer, both are psychologists here at ChristianaCare. You may remember Suzanne from mental health videos that we've previously done here on Facebook Live. Stacey is joining us for the first time today. She's a member of ChristianaCare's Center for WorkLife Wellbeing. Thank you both for joining us today.
Thank you.
Thank you.
And Stacey, you're new to joining us, so why don't you take a minute to introduce what the Center of WorkLife Wellbeing is doing right now?
A lot of things. So just a little bit about us. We are a group of 12 people at ChristianaCare who are dedicated just to helping caregivers. And we do this in a lot of different ways. So at ChristianaCare, we call every single employee a caregiver, regardless of role. And this is really important because we recognize that people in all different roles could choose to work anywhere, but they choose to work for a health system. And with that comes a lot of benefits and some challenges, as you might imagine, working in the face of a pandemic in the past year. So our group of 12, the Center for WorkLife Wellbeing, was formed actually well before the pandemic in 2016. ChristianaCare really committed to thinking about and improving well-being of our caregivers in a really innovative way that is kind of cutting edge in the United States, actually. And so what we do on my team are create programs, and we do a lot of education, and we also have advocacy efforts to improve the well-being of all ChristianaCare caregivers.
Great, thank you. And before we get started, we thought it would be a good idea just to run through some of the definitions of the terms that we may use during this conversation. For example, Stacey, your program is the Center for Work-Life Wellbeing, but well-being can take on so many definitions. So what is well-being in the way that we'll be talking about it today?
I love this question. I often talk about well-being with people, and what usually comes to mind is personal well-being. So people talk to me about their physical well-being, emotional health, financial health. So, they think I have to eat a salad every meal or I need to exercise all the time. And that may be a component of your well-being. But we recognize that well-being is actually far more complex. And for example, when we think about life satisfaction, we know that a good chunk of your life satisfaction is related to your work. In fact, 40%. And so we think about well-being as being in part related to your personal well-being, that physical, emotional, and financial health, but also the culture of well-being in which you work and the efficiency of your work. These things also have a tremendous impact on your day. So imagine if you use the computer for your job and all of a sudden your computer is not working and you can't log on for that meeting, or you have a kid who's doing distance learning and you can't get on to their class, or the register is going down in a retail store, or you can't find the supplies that you need to clean. Whatever your role, that efficiency of work is hugely important, as is the culture of well-being around which you work.
Absolutely. And I think that that's not only important to understand, but an important part of the conversation that we're going to have today. And another term that I think will come up a lot is mental load. I know when we spoke off camera preparing for this conversation, that's a term that I didn't fully understand. So let's break that down as well.
Yeah, so mental load is really the things that you're carrying around with you and you're thinking about day to day. So, it may be the list that you have, the tasks that you have to do, appointments that are coming up, how you're going to help your children during the day, all of those things that you're thinking about and carrying around with you. And generally, people have a pretty substantial load, but the pandemic has really added to that, right? And it's those small things like, did I grab a clean mask? Do my kids have one for school? I have to have one before I go to the grocery store. Now I have to follow these arrows and make sure I give social distancing to people. The social rules that we have now are so different. It used to be polite to hold the door open for someone and they would pass by you. And now we have to give people so much space. And so it's all these things that we're thinking about all of the time and we're carrying around. And that load has gotten heavier and heavier. And so, when people feel like, God, things are just hard, They are, because what you were able to do before is still there. And on top of that are all of these extra requirements that you have to think about on a day-to-day level.
And I think burnout is maybe the word a lot of people are thinking of, and the word that has been tossed around a lot over the last year. How does mental load turn into burnout? What is burnout by that clinical definition?
Sure. Yeah. Burnout is really, if you think about that load and what you can carry, what you can hold, what you can handle, when you start putting more of that on for a longer period of time, you just end up wearing out. Either fatigue, you're not as excited about things, you don't find the same meaning and fulfillment in the things that you did before. And I really think about this, you talked about exercise, right? So I'm not very strong, but let's say I was trying to lift weights, and I know that I can lift 20 pounds. So I'm going to add a little bit more weight to it. And okay, I think I can do that. And I add a little bit more and I add a little bit more. At some point, I'm physically not going to be able to do it anymore. Not because I'm weak or I'm inadequate. I just can't, because I've reached my level of capacity, right? And I've overshot that. And that's really what burnout is, but in a more physical and emotional and mental perspective.
I think that's really important for a lot of people to understand. Burnout is certainly a word that many have been using, as well as all the other terms we've covered so far. But Stacey, I know you're also talking about collective trauma. And I think trauma is another word people may not fully understand, and collective trauma seems a little bit even more confusing. So explain to our viewers what that definition of collective trauma could be.
Sure. So I'm going to use Suzanne's metaphor here of the weightlifting and thinking about us, trying to carry the weight, and it's getting heavier and heavier. And collective trauma is really as if something just dropped on you, and 1,000-pound weight, and you're trying to figure out how to survive in the midst of that, and you can't possibly hold it all. And what it actually means is it's an event or events that affect an entire group of people, as if we were all trying to hold weights at the same time and we just couldn't do it anymore. It severs the ties that bind us as a community, as members to one another. And with this pandemic, I can't think of a better example in some ways, because we literally cannot be together. Just acknowledging the fact that we're doing this in separate rooms right now.
Yeah.
How different our lives are over the course of this past year. We are living through still collective trauma, something that's affecting us in a wide variety of ways. And it differs person to person for a lot of different reasons, based on what you might have had, going on before this hit, and what you've had throughout, and what you might have hopefully after one day, when we get to the portion where we could say after. But it's just something, when we think of that term, that affects all of us.
And I think, as you mentioned, so many people have experienced this pandemic differently. They were going through completely different things on March 10th of 2020 and have experienced so much different since then. But we talk about collective trauma and shared experiences. How can we have shared experiences when our experiences have been so different?
Yeah, I think the fundamental first part of that is the entire world is going through this. Every single person on this planet has been affected. And whether you've been profoundly affected, maybe by the loss of a loved one, personal illness, the loss of a job, something like that, or maybe the effect for you has been more of a nuisance, that, it's harder to go to the grocery store. In some way, you have been impacted by this because everyone's life has changed. Like Stacey pointed out, we can't even be in the same room to talk to one another. That schools have all been profoundly affected. Workplaces have been profoundly affected. Everything in our lives that we took for granted, birthday parties, now we do them as a drive-by. You don't have get-togethers for little children anymore. Weddings were put on hold. Just the multitude of things that I think people maybe took for granted or just assumed were part of normal life and couldn't be impacted have been. And that's true for everyone. And also, in order to keep everyone safe, we all have to continue to do these things and have our lives be affected. So it's kind of like this ongoing circular pattern that, may weigh on you heavily day to day and may kind of have this cursory impact on you.
Mm-hmm.
I love this point, Suzanne. I'm a trauma specialist by training, and so much of my work has been working with trauma survivors. And I often hear very differing experiences, of course, and people will say to me, there's a sense that, oh, I shouldn't complain because I know this person had it worse than I had it. And I really want us all during this conversation to be very thoughtful about this, because whatever you are feeling is absolutely understandable and okay. And we all have different experiences of what's happened over the past year, but we can't look to someone else and say, oh, well, they had it worse than I had it, so I'm not entitled to my feelings, because you absolutely are. And some people may have had a very different experience of the past year and found clarity in their life, perhaps, that has been welcomed and found things that they're really grateful for. And some people may have had profound loss. Whatever your experience is important, it matters, and it's valid. And so when we talk about things today, you may hear me talk about caregivers, because that's the world I live in, right? I'm thinking about our caregivers here. They've had a really hard year. And I might say things about their experience. I want you to know that if you haven't had that experience, what you have experienced still matters.
Absolutely. And I think this is a very interesting time to bring in our first question from a viewer that ties right into this conversation. Jennifer B is asking, how can I stay emotionally strong during such a long haul? And I think that goes right into the next point we were going to make about what emotions is it okay to be feeling, and what emotions should I be concerned about? How are you allowed to feel right now?
I would love to share a little bit of our conversation leading up to today, because
Sure.
I think it'll illuminate this point that you feel what you feel. In my home, leading up to today, I noticed a lot of different reactions in myself. I noticed over the past few weeks, I've become a little quieter. A little more withdrawn or internal to myself in a way that perhaps is not as common for me. I'm sometimes a little more irritable. I feel sometimes frustrated. And I recognized when I had a moment to think about what March 11th means to me. Well, about 1 year ago, so it was like March 13th, one of my children came home sick. And the following day, my spouse became sick. And so for my home, this time of the year, I have a lot of feelings right now because our whole world has been changed. My spouse has long haul symptoms. It's been a really challenging year for our family. And when we were talking about this conversation today, I realized that other people had totally different experiences. And if you'd be comfortable to share some of what we discussed, I think that would be great.
Absolutely. Go ahead, Suzanne.
Yeah, we talked about this a little bit yesterday, and then I reflected on it a little more. And my first impulse was there were things that became easier for me because of the pandemic. I started working from home. And so that gave me 2 hours of a commute back in my life, and I got to see my children more. And then I thought about all of the changes that made, not only in my work experience and the new skills I had to learn in work that now are commonplace. So I kind of forgot that I had to learn how to keep my 4-year-old out of my work meetings. And hopefully if she did come in, she would be fully clothed, that I had all of those incidences and technological difficulties. But then my husband's work life didn't change. And he is a government employee and was really exposed to a lot of questionable, when there was, questions about, do we wear a mask? Do we not wear a mask? And things like that. And that brought a lot of stress into our family, and our family rules shifted. because I was home, I took on a lot more of those responsibilities and had to sort of integrate them into my work day. And if I was working in my bedroom, my work was in my bedroom. And if I was working in the kitchen, the dirty dishes were at work, you know? And so trying to find that work-life balance was something that I struggled with. And on reflection, I've realized how much we've accommodated to that, but how much that then led to irritability and frustration. And for me, wanting to talk to people all the time, not being quieter because I had less access to people outside my immediate family. And so I was like craving that. And so in some ways, it's a very opposite reaction to some of the experiences that Stacey had.
Absolutely. And I know that I shared with both of you yesterday, 1 year ago today was one of the first videos that I did with Dr. Marcy Dries, who many of our viewers, I'm sure, have gotten used to seeing in our videos over the last year. And at the time we were shooting, my phone went off and it said, World Health Organization declares COVID-19 a global pandemic. And I looked at her and said, oh, what does that mean? And I had no, real connection to it as someone who doesn't provide actual care. I work in the external affairs and the communications department. So at the time, I really had no frame of reference of what a global pandemic really meant in this setting. And now I have friends who text me and ask me about wearing masks, social distancing, holding weddings, holding baby showers. And I've somehow gained so much medical knowledge that a year ago I was, asking Dr. Dries if I should be concerned about the pandemic designation. So all of that has changed and the education and things you think about. Because while I was already working in healthcare communications, it was a very different conversation last March than it is today. And I looked at the video this morning, we were not wearing masks. We were barely 6 feet apart because all of that was still very up in the air as well at the time. And now we've changed it to, all of these interviews are virtual and how much that has shifted and changed. And as basic as that seems, it's still a major change that when looking back on it today, you realize how much that's impacted your day-to-day work. Mm-hmm. And we do have another question. Jennifer B. also asks, how can I keep my school-aged children emotionally strong? I know both of you are parents and you've talked about how just having your kids home has impacted you, but what about the way your kids are feeling and how much they either know or don't know about what's going on in the world?
Yeah, and we've talked about this, you and I, a couple of times in the past, mm-hmm. Megan, and I feel like, I would reiterate the same point, that it's important to validate your children's experience, to give them an opportunity to give voice to that experience. I think as parents, we so often want our children to not feel bad. We want them to be happy. We want them to have a fulfilling life, that it can be really easy to try to rush to the fix it part. But to help them learn, this is such a lifelong skill to have, to learn to sit with those emotions, to be able to really give voice to them and maybe help your child problem solve. What do they think could be better or could be a solution? Because they might come up with something that you would never think of. My kids do that all the time. And then they own it, and they've solved this problem on their own, but they didn't have to rush to push away their emotions. It's okay to be sad. It's okay to be disappointed and give those labels. My youngest is 3 and when he gets upset and he tells me he's mad at me, I'm like, you're disappointed. And he's like, yeah, I'm disappointed, And so little kids can get that and can differentiate these big emotions. And we help to hold that for them and make it okay. And then work them towards a solution. But it's hard because we have to kind of hold our own in check to be able to allow them to have theirs. And as an adult, that's one of the hardest things because many of us are still learning this as adults. We didn't get the opportunity to learn this as children. So it's a gift you can give your child, but it's a really challenging one to do, especially if you're feeling your own really strong emotions at the same time.
Absolutely. And I know that we've referenced here in this conversation, and we've also spoke offline about emotions being on a sliding scale. Just like you mentioned, so many people have experienced things differently. People feel things differently, and many people feel things differently, separate and apart from this pandemic, and that's just the way that the world is. But what would you say to someone who may be watching, who's thinking, none of my family members have gotten sick, I didn't lose my job, who am I to feel stressed, anxious, upset, I have no right? What would you say to that person?
Things feel harder because they are harder. As Suzanne mentioned, just going to the grocery store is an adventure. You're trying to get out of there as fast as you can, being respectful of other space, following the arrows, right? It's the little things, and they add up.
Absolutely. And Stacey, I know that we've mentioned that you work with our caregivers. So there's really that sliding scale in terms of what a lot of our doctors and nurses have had to go through. So what would you be able to pass along to maybe our viewers who are thinking, I feel like I need to do something, I feel like I need to help?
Absolutely. So I think this is a really important point that for some of us, acts of kindness and helping are also important for our own healing, and our own space, right? And I want you to know, just on behalf of the caregivers, and of course I can't speak for everyone, but the folks that I have spoken with directly have reiterated to me just how thankful they are for everything that the community has done to support them. So a year ago, you were sending in, meals and donations, and you're still doing it. And anytime that comes in, it's so meaningful, and it reminds everyone here who, people have been doing this for a year, and they're providing exceptional patient care, and they're tired, and still doing it. Like it's amazing. Healthcare workers, what we know even from the research is that when they get tired, they actually work harder. Like they work harder. So, and that's what our caregivers are doing and have done. So anything like any donation cards that people have written, my group will make copies of those cards, and we go around with what's called the Wellbeing Wagon, where we bring food and basic supplies like chapstick, because your lips get really chapped when you're wearing a mask all day, or ear savers so that your ears are not broken down from the masks. We give out these cards. We copy them and we give them out. They see your words that you send in, and it's meaningful. So if you at all have the bandwidth or the desire to do that, please know it's appreciated. Just yesterday, we had a car parade from Chase. It's hugely appreciated. And it's important for caregivers to be recognized, especially around this 1 year mark, because everyone's aware that we've been doing this for a year now. Just as you have been doing it for a year now in the community. So I just want to reiterate that we are so thankful for anything that comes our way. Thank you all.
Absolutely. And this being the 1 year anniversary, and you referenced acknowledging that today is the 1 year anniversary and that we've now been through a year, is there a certain emotion that people may feel today, or may now start feeling, that maybe the last year was such a whirlwind, they really didn't sit down to think about it, but this conversation or a moment of reflection or just realizing that it's the anniversary may kind of flip that switch, and now all of a sudden they're realizing either, wow, I'm not okay, or whatever their emotion might be?
I think people could experience a lot of emotions. One thing that we've been trying to do, because it can get complicated when you think about the past year of your life, you may be flooded with thoughts and feelings that come up for you, and they may be conflicting. And that's okay. One thing that we have been working with our caregivers on is we call it 1 year, 1 word. So perhaps when you pause for a moment of reflection, as we did today, maybe during that moment, one particular word kind of rises to the top, and you recognize that as your experience. I'll share my word for me was despair. And I needed to notice that and let myself feel that. Not everyone's going to have the same word. You know, when we looked at the hundreds of responses that we received from our caregivers, some people noted hope and gratitude and happiness and a lot of differing experiences. Some people said exhausted. You know, it's a wide range. So for you, you might have a wide range of emotions, but even just letting yourself notice, okay, where does my mind go? Is there one feeling or one thought that seems to be the most prominent for me? And kind of reflecting on that. What do I think about that thought?
And I think it's interesting that you included some things that we may not think about as emotions, things like exhaustion or confusion or isolation, things like that, that some of what we're feeling is hard to put into feeling words, and we may experience it in our body. We may be achy or tired or wound up or any of those kinds of things too. And so those are also ways that you could really be experiencing this. And for some people, it's easier to notice those experiences than give voice to feeling words. So if that's where it's coming through for you, that's also a perfectly fine and real experience of what's been going on.
And what about those who now a year later are realizing their life has just been on pause? Maybe they had to reschedule a wedding or reschedule a wedding more than once, or they put off that, backpacking through Europe trip or starting their family, or things that in their mind last March were where that next year was bringing them. And where normally maybe birthdays or New Year's Eve kind of spark that reflection, today specifically, they're really realizing that things that they've missed, or I don't know what the next year is going to be. I don't know if I will be able to travel this summer or have my dream wedding in the fall, or those people who now just are feeling really uncomfortable in their feelings of not knowing what it is maybe that they are feeling.
I would say you've lost things. You've lost things this past year. And those things may differ, like all that we're talking about, on a spectrum. And it may take a little time to sort out how you feel about that. Particularly, one point that I'd like to make around this is that, we're starting to see, thankfully, our numbers continue to decrease, which I hope that they continue to do that, and especially as more people get vaccinated. But as we have that, there's going to be a little bit more of a pause, I think, where we can begin to notice these things that we've put on hold, or the things that we've lost. And you may have a variety of feelings come up for you around that, and recognition, even for the first time, of all that you've had to put on hold, right? So understandable if it feels confusing, understandable if it feels sad, understandable if it feels frustrating, if you feel angry, or if you don't have the space to even think about that right now. Because some of our caregivers, they don't have the space to think about that right now. They're still fighting every day to take good care of patients. So that's what I would say, is that you've lost things, and it's important to recognize that you've had to put things on hold.
And Suzanne, let's circle back to kind of the point we were making earlier. What about the people who are sitting, you just heard what Stacey said, are sitting there and are saying, I haven't lost enough. What I've lost is trivial. What I've lost is just time. I shouldn't feel this way. What should we say to them? What should we remind them right now?
When we were talking yesterday, we kind of talked about this idea of maybe you get out your smartphone, right, and you scroll through your photos of the year. And I think that idea was actually a little bit what triggered me to really go back and think about, month to month, what sort of happened. Because I think, like I was sort of suggesting with my example, we become complacent. We acclimate to what has happened to us, and it just becomes life as it is. And so going back and looking through and just re-experiencing your experience just by itself. It doesn't have to be in comparison to anyone else. It doesn't have to be bigger or more or less. It doesn't have to have a qualifier like that. It's just your experience. And, you know, I've talked to some of the patients that I work with, and for them to also be able to talk to somebody else that has a similar experience, to get that validation that, you know, I have really been overwhelmed and anxious about this. I'm not the only one. My reaction is normal. And it's one thing when a professional tells you that, but it's another thing when someone else who has the same experience tells you that, and you can sort of allow yourself to have those feelings. I think that, you know, as Stacey has been saying, the feelings that you have are yours, and you're having them for a reason, and acknowledging them and sort of sitting with them is a way to help you move to the place you want to go if you don't want to stay in those emotions, you know. And so find that time for reflection. And we talked a little bit about that might be hard with kids. So maybe do that with them and help them remember the things that happened in the before time, you know, and then help them think about the after time, so that there is that opportunity for hope and growth for yourself and your children and your family.
I've done this in my own life. I'll share that I use an app, and I compile photographs, and it puts it to music for me. And I found that there are things that I would not have remembered. Like I have a picture of when we had a hailstorm a year ago, and I had completely forgotten about that because of all the things that have happened since then, right? But I have these videos of pictures that are my photo journal, really, to look back on, not only for myself, but to show my children, so that we can look back at this experience together. Mm-hmm. And there are, as Suzanne's saying, there's so many things you can do with, if you have children, to help them find their experience and language around this, depending on their ages. But being able to sit down and make a photo album with your kids and talk about these things. You know, one of my children, my oldest child, will talk about, he has a great memory, and he will bring up all the time, do you remember this, Mom? And yes, I do, buddy. And these are important things. And he's asking me to validate his experience. So this is a great way that we can hold what has happened to us over the past year. And if we don't have the capacity right now to really reflect about all these things, that's okay. We can snap a photo that day of something that looks interesting to us and look back on it months from now when you do. Or make a playlist of music that's meaningful to you, that captures your experience from the past year. It's just to have that and say, this is my, 2020 playlist, and this is my March 2020 to March 2021. This is what life was like for me. Mm-hmm. And years from now, you will have that.
And what if someone is watching who they personally may be feeling okay, but they know that a friend or a family member is really struggling? What advice would you give them to reach out and help that person?
Yeah, I would certainly say, you could reach out for mental health supports. If it's truly an emergency, obviously you can call like 911 or something like that. But I think for most people, it is really helpful to talk to someone, and maybe someone, therapy is often helpful because you don't have to then go and talk to that person later. It's in this isolated space, and it's your personal time to talk. How many of us get our own personal time to talk just about ourselves to someone who's not really going to talk about themselves in return? We have behavioral health services here at the hospital. We have psychologists and psychiatrists available. We have behavioral health consultants that are embedded in our private practices. So we have lots of opportunities here at Christiana. But you can also just call your insurance provider and see who a local provider that's covered could be, if you just really need that opportunity to talk to someone and help to understand what your experience is.
And I would like to remind, if you're a ChristianaCare caregiver, I'd like to remind you that we do have peer support through Care for the Caregiver, available to all ChristianaCare caregivers. Our peer support program is very active. I think we did 500 engagements last year. So please know it's here for you if you want or need that. Also, we have services through our employee assistance program, Aetna RFL. Whether or not you are full-time, per diem, whatever status you are at ChristianaCare, you can access 5 free counseling sessions through Aetna RFL. Or you can contact, if you have Aetna insurance, you can contact them and get their full behavioral health panel. And if you're medical dental staff, we have Vital Work Life also available to you. So I want to make sure people know of these services. You can always reach out to the Center for Work-Life Wellbeing, and we'll help you navigate that if you run into difficulties.
Thank you, Stacey. I know that's important. Of the 13,000 caregivers that we have, many of them are friends with us here on our social media channels. So they are sure to be watching as well. So that was incredibly important to point out. I think that the three of us could probably talk about this for hours, but we are getting close to our time for this conversation today. So I'd love for both of you just to take a minute and share your key takeaway from this conversation that you'd like to share with our audience. Suzanne, go first.
Okay, I was waiting for Stacey to go first. I think, the key is really, we've all gone through a global event in our own way. And that the way that you've experienced that event is a real and true experience for you, and your reactions to it are valid, right? And I think, we often focus, you and I, when I talk with you about families and children, and that it can be really, as hard as it is for us as adults to understand this, it's so much harder for children because they don't have, the language or the education or the experience that we do. So the best thing you can do as a parent or a family member is just to listen, to let someone share their experience with you without judgment, the way you would want yours to be heard, and to just say, and that's okay. So that we can start to rebuild those bonds of connection that have been so impacted by this pandemic.
I love that. So beautifully said, Suzanne. And I will piggyback on that, that just as we would listen to our loved ones, we need to listen to ourselves and show ourselves self-compassion. And what I mean by that is talk to ourselves how we would a friend, how we would talk to a dear friend. Oftentimes what we say to ourselves is so harsh, and we talk to ourselves very unkindly most of the time, right? But when you find yourself doing that, check in and say, okay, what would I say to a friend right now? I wouldn't say what you're feeling is ridiculous, or you shouldn't feel that way. I would say, oh, I'm glad that you told me how you're feeling. Tell me more. What brought this up in you? You would want to ask them how they're doing and what's going on with them. And you would provide support for them most likely. So one of the things I often ask caregivers is to think about how much support they would provide someone else. Because caregivers at ChristianaCare and everywhere, they are caregivers to the core. Give and give and give to everyone, usually in many areas of their life, not just at the health system, right? They're helping families, they're helping the community. And so I ask, if you had a good friend who needed your help every day for a month, how much time would you commit to them? Realistically, in my life, I could commit 5 minutes. Now, that may not sound like a lot, but that's where I'm at right now in my life, and that's okay. Now, the question then I ask the caregivers is, okay, you could commit to 5 minutes, 15 minutes, 30 minutes. Can you do that for yourself? Can you make that space for yourself, even today, and allow yourself to reflect on how you're feeling, talk to yourself with kindness, and be curious, and recognize that with any anniversary, it's going to bring up a wide variety of experiences and feelings, and that's okay. So that's what I would like people to take away from today, is talking to yourself kindly with curiosity, and taking this opportunity around an anniversary for a moment of reflection.
Thank you both so much for sharing your knowledge and your guidance today. And thank you at home for joining us for this conversation on shared experiences. We're sure it will not be the only conversation we have on this topic as we navigate through the next year and continue to live with COVID-19. So thank you for joining us. For more information on any of our behavioral health services, please visit ChristianaCare.org. Thank you and have a great afternoon.